Say, Liz, can you help us a little bit with minutes, taking some notes? Can you help me with minutes, taking notes this evening?
Yes.
Okay, thank you, Liz.
What, take them in?
Just take some notes.
I think I'm gonna hold on that just because I got like 2 other sets to do right now.
You can give me, okay.
So, maybe next
any-
time.
Anyway,
You know, it's a lot right now.
okay, we have, my name is Laquita Henry. I am co-chair of Health and Environment. And I apologize for our being a little bit later starting than usual. We're in a new setup. We had to meet on the office side because there are 2 committees meeting tonight, and the other committee has more in-person presentations. We also did not have a quorum. Our members are to meet in person, but we got lucky when Liz walked in. We have 8 committee members and 5 must be here in person before it counted as a meeting. So I appreciate the ones who are here in person, and the probably there are new strictures. So what we need to do is know the day before with our committee members to just let me know for sure you're going to be in person. Otherwise, we have a meeting, but it's not official. And so that becomes a disappointment. So as long as everyone can hear, I think we will be okay. We have present in the room Monique Hardin Cordero, who is also second vice chair of Community Board 9. We have Elizabeth Eastman, the one I was trying to cajole into doing some notes tonight. And we have Amir Sadeghi, who's a ardent member, as well as Heather Jason. So those are in person, and we have, I think we have another member who is maybe 2 on the phone. All members on the phone have to have their cameras on. That's the other thing so. Okay, I think we can get started right now.
Oh, our chair's on too. Do you want to introduce him? Victor?
Oh, Victor's on? Yes, and we have our chair, Victor Edwards. I didn't see Victor.
Yep, he's there.
Okay.
Good evening, all. Good evening. Thank you for attending the meeting this evening. I appreciate it. We have a lot of important topics I see on the agendas. I just wanted to stop it and say hello to everybody and take notes. Thank you.
Thank you, Chair.
Thank you. Yeah, anything, try to maneuver a couple of things here, so if we see someone in the chat or a note in the chat, just let me know, so I may miss it.
Okay.
Okay, just give me a couple of seconds more. We have called the meeting to order. You have the agenda. Can I get a motion to accept the agenda as presented, or if you need to add an item, please allow, just mention what that is.
Second.
I motion to accept the agenda.
Okay.
Seconded by.
So Amir has moved to accept the agenda, seconded by Monique. All those in favor, say aye.
Aye.
The minutes you received last week, I have to admit they're generally in good order. It's our meeting, from October. The only, thing I would add is, the vote at the end in terms of how we were gonna handle the resolution should be added in. And so that's on the recording, and so we'll just, that's what I would recommend adding in. Any other, adjustments? We heartily appreciate Patricia Ramos for doing our minutes. I'm not sure, I think this might be the meeting where she said she, had to be excused, to be honest with you. So we'll just get everything from our recording. So can we get a motion to accept the minutes with that correction or any, corrections?
I move to accept the amendment, the minutes with any necessary corrections.
Can I get a second?
I second that motion.
Thank you. All those in favor?
Sure.
Everyone is.
Now I'm trying to find catch to log on so I can
Okay.
see the,
Um,
yes, I'm in favor.
Thank
Heather,
you.
you're in
So
favor?
the minutes also have been properly moved and seconded. I'm gonna move ahead, let's see, with our first discussion, and I'll do some of the announcements a little later. Oh, I see that there. Thank you so much. Now I'm gonna have to, I'm manipulating a couple of screens here. Okay, do we have, is Philip here, Philip Malakowski?
I believe he is.
Philip, let me hear you.
Yes, I'm here.
Oh, we can't see you though. Okay, you have your name there though. And then, let's see, do we have someone here from the Regional Plan Association? Or Streetopia?
Or I think it's open plan, Street Utopia is
Or
a,
Open Plan? It doesn't
Yeah,
matter.
Streetopia. I'm here.
Okay, welcome. That's Sarah, is it?
Yep.
Okay, so both of you know, well, I don't know if we have someone from the office of Councilmember Carmen De La Rosa or from the office of Councilmember Sean Gray. If we have, can you identify yourselves? Okay, and if anyone notices them a little bit later, if you see a name for the office, just highlight it for me.
Okay.
Okay, so as the two of you know, we've had pretty hearty discussion on residential parking. And I'm of the mind that we need to hear as many different ideas and serious thinking from the standpoint of the community as possible. And we need to be as visionary as possible. It's a discussion that has come to light citywide, maybe not as vigorously, but it's beginning to get talked about a lot more. And in terms of what it means for people who live in a particular community or don't live in the community and will be visiting that community, what it will do to, if there's pricing involved, parking is such, you know, in such a small number and seemingly getting reduced every day, even with certain things that we want, like particular kinds of trash bins that end up taking up a lot of parking place space. So there are a lot of obstacles to it, but then we have to weigh the pros and cons, and I'm for doing that. We have drafted a concept that the majority feel we're on the right track with. That doesn't mean that there isn't, you know, one exception to it. So this meeting and next meeting, we need to devote time to hearing the thinking of those who have studied this and worked with it. So I'd like to hear, I don't know how different your thoughts are, but let's hear from Philip. first and then from Sarah. If you could devote, let's say, do you need access, Philip, to, we need to be made a co-host? I don't know if you have, diagrams. or
No,
something.
I don't have a presentation here, but I was mostly coming here just to answer any questions, but and provide like
You can maybe give an
any
intro.
research. But I'm
So-
happy to kind of, open the discussion here if that's what you're looking for.
Can you hear me? Can you hear
Yes.
me? Okay, so I was gonna suggest that maybe if you had like, say, 4 minutes to give an overview, and then Sarah as well, and then, discussion. And we can ask questions. We're coming pretty open-minded about it, so, as long as you can, give us the most objective opinion that you have from your studies. And I also wanna thank Amir for bringing you to my attention and to Edwin's attention. He did the outreach on this and, not only giving us, your name, but opening the door then for Sarah to be here as well. So, okay, Philip, you, try to limit it to 4 minutes, and then also, then we'll have Sarah the same, okay? Take it away, Philip.
Great. Hi, everyone. I'm Philip Mietkowski. I'm the Senior Director of Research and Policy at Transportation Alternatives. I'll be pretty brief here because I'd love to have a discussion here and hand it off to Sarah. But I'll be completely honest, I 100% understand the allure of residential parking permits, and that's why they are so common in cities around the world. But I do want to raise that there are some very serious concerns, with the residential parking permit program. And Gail Brewer, when she was the Manhattan Borough President, looked at residential parking permit programs around the US and around the world. And she also concluded in her report that she found a really difficult time finding a successful program anywhere, and that there are significant drawbacks no matter how you design the program. For example, if you just look at the price of the residential parking permits, if you price the permits too low, then you'll hand out too many. And then there'll be, very disgruntled drivers circling for parking with the expectation that because they paid for a residential parking permit, that there's enough parking spaces in the community board. But if you price the permits too high, then there are serious equity concerns. So finding that right balance is extremely difficult. And there are other concerns that I'm happy to get into as well, even as simple as having a visitor, having somebody, family member to come and visit you for a day, or a plumber, or for someone to come in and shop in the neighborhood. There's plenty of concerns there. I would also be amiss if I didn't mention that New York does have a serious placard abuse problem. So bringing in a new permitting program like residential parking permit only invites potential abuse of the program as well, which would potentially then flood lots of fake placards for parking. But there is, I think, an alternative that I would like to mention. There is dynamic metered parking. It's slightly different than metered parking in the sense that price of parking on the block changes depending on the day and depending on the time of the day, and depending on the location as well. With dynamic metered parking, the goal is that there would be on average 1 to 2 free parking spaces on every block so if in the previous month there was very rarely a parking spot or 2 that were free during a particular hour, then in the next month the price would increase. But if there's lots of parking on that block, then that same hour in the next month, the price would drop to invite people to park there instead. San Francisco did this, C has done this as well. And it prices the block for exactly what the type of the demand is based on location, time of day, day of the week, like I mentioned. And in San Francisco, they saw huge benefits for that. They saw both for drivers and non-drivers. They saw parking search times drop 67%. There was a 23% drop in citations, actually. There was a 3% reduction in greenhouse gas emissions and 30% reduction in circling, looking for parking as well. And the areas where the metered parking did go in also saw a 30% increase in shoppers, diners, and those seeking entertainment. So I'll wrap up there just to hand off the baton to Sarah, but I'm more than happy to take any questions or expand on any of the points I raised.
So Philip, you are in favor of residential parking? Or you are not?
No, I think I understand the allure of it, but I think that there are serious concerns. I echo what Gail Brewer has found when she looked at residential parking permits around the world, that there's no way to really design a residential parking permit program that is successful. Like, you know, when you, if you just look at pricing, if you price it too low, then you're going to give out too many permits, and people are going to expect a parking space. And if you price it too high, you know, for an annual permit, then there are going to be serious equity concerns. And it's extremely difficult to find that middle ground. And that middle ground is probably a couple $1,000s a year, you know, just to give a sense of how much the curb space in New York City is worth.
Do you have some information on gas emissions, if there would be any impact, like less gas emission, or what would be the health or environmental benefits? Do you have any information on that? And I might have, anyway, do you have any information on that in terms of gas, limiting gas emissions?
Was that for me?
Residential. Mm-hmm.
Yeah, the only way to reduce gas emissions or circling around looking for parking is if you give out only the number of residential parking permits that there are of spaces in the community board. So if you were to survey the entire community board, and I'm making this up, and find that there are 5,000 parking spaces, then you can only give out 5,000 parking permits, and then you'll reduce the circling around and gas emissions. Otherwise, if you are giving out parking permits to anyone who's willing to pay the $25 or $50 annual fee like we see in most cities, then you'll hand out significantly more parking permits than there are actual spaces in the community board. And then there are no reductions in circling or greenhouse gas emissions.
And I would add potentially even an increase, because to Philip's point, if people think, oh, I can get this residential parking permit and I'll be able to park on the street, but it's not a guarantee that you'll find a spot, but you might incentivize people to buy a car who otherwise wouldn't have, thinking that they can easily park on the street.
And I thank you for saying that, Sarah. You know, I think it's hard not to interpret the current Senate proposal around residential parking permits as an incentive. It's basically a public subsidy for automobile use, which is exactly what the intent of this resolution seems to be motivated to address. You know, the intent of this resolution seems to want to address better environmental health outcomes, reducing emissions. But, you know, Sarah, I think that that's a really strong point that I've actually heard echoed by other urban planners, you know, who I've come in contact with, that counterintuitively residential parking permits might increase the number of cars idling on the streets, circling and scouring for limited parking spaces. So you know, and I at our last community board meeting for this committee, I talked, you know, a little bit about some of my concerns. And, you know, over the last month, I've compiled a lot of research and interesting perspectives from you know, the Regional Plan Association, open plans, transportation alternatives, and, you know, I think there's the concerns that Philip has reiterated around what pricing is most effective to achieve the goals and the outcomes that we're seeking. And it seems like a lot of folks think that the pricing for parking permits have to be market rate, right? New York City real estate is incredibly valuable, as we all unfortunately know intimately. It's hard to live here, and New York City real estate is valuable. Therefore, you know, residential parking permits that basically privatize the public right of way for permanent car storage should mean that residential parking permits should be market rate, and that's not really talked about in this resolution.
Well, this is a draft, now, it's not final, it's a draft, and we're listening to other opinions so that if those, you know, if we pursue the proposal, then that's another consideration. But I'm staying open to it, but I hear your argument, but this is not final.
And, you know, I do appreciate that, and I see some hands are raised, so I don't want to speak too much longer, because I'd like to give the folks who have their hands raised
I
a
don't think
chance.
we gave Sarah a chance to say a bit more.
Sure. Yeah, I mean, I think Philip said it all really. One thing I'll just add is, you know, it's not like every neighborhood is the same. And we all know in New York City, right? Like there are vastly different neighborhoods. And so if you're talking about a relatively low density neighborhood where the amount of parking spaces on the street is kind of correlated to a certain extent to the population of people who own a car in that district, a residential parking permit system might make sense. You know, where you see these systems in place in a lot of other cities, they're much lower density than New York City. But I think in, you know, Manhattan Community Board 9 is a pretty dense neighborhood, obviously not as dense as maybe some other parts of Manhattan, but relative to, you know, anywhere else in the country, a very, very dense neighborhood. And so there's just like such a limited amount of space relative to the population in the district that, again, if you incentivize even just, you know, 0.5% more people to own a car because they think they can park easily, it's going to be pretty chaotic. I'm wondering if one of the incentives behind this, and I don't want to throw a wrench in things, but if folks were concerned about congestion pricing and people coming in and parking, was that at all a concern here, or was it really just local?
Yes.
I'm
Yeah.
sure that was part of it.
Definitely, that came up.
Yeah, I mean, so I've definitely heard that concern. And I think it's unlikely to happen. I think that for one thing, I think a lot of people are just going to pay the toll. And frankly, we're hoping that they do, because part of this is to raise money for the MTA. So if everyone stopped driving into the central business district, we would be in trouble. And I think that, you know, we know that people who drive in are higher income and are likely to just sort of take the hit and pay the toll. And then I think that people who decide they don't want to drive in are going to see that parking in, you know, I live on the Upper West Side, parking on the Upper West Side, parking in Harlem, parking in, you know, Morningside Heights is not going to be easy for them. And so if people try, I think they're going to quickly learn, like, that's not going to be a solution to their problems. And they're going to have to find other ways to get into the central business district.
Thank you, Sarah. So both of you stay posted. Victor has his hand up, and then Sec with a statement or question, and then
Monica Dula had a hand up before me, so I
apologize because I'm just
Problem.
looking at this with
yeah,
your hand.
no,
So Monica, and then Victor, and then Heather's.
Heather,
And
yes.
I did see come up after the others. Okay, so in that order.
So, hi, thank you guys for coming, but clearly there seems to be a naivety about this particular community and who's parking here. We have an influx of students from City College. They do not live in this community, but they take up our parking spaces. We have an influx of people that come into our community and they take the A, the D, the 1, the B, and the C to wherever they work. and they park their cars in our community. These are people who do not live in our community. They do not contribute to it, but they take up parking spaces. Parking permits should be free to the people that live here. We have to pay taxes on our cars. We have to pay tax on insurance. We have to pay tax to register our cars. We have to pay tax to get our cars inspected. Those are all things that we pay for. We shouldn't have to pay anything additional. As for encouraging people to buy cars, nothing in New York City encourages people to buy cars. There has been an increase in registered cars since the pandemic, but that was because people did not want to take public transportation. And our community has one of the biggest increases of people who are owning cars. So, we have to be able to analyze the complete community. Also, in this community, there are a lot of people that do not work in areas where there is public transportation, and their car is the only way that they can get there. People that work in Upper Connecticut, people that work in Delaware, Southern New Jersey, way out in Pennsylvania. I don't know if you realize this, but buses don't always run and trains don't always run. For example, there is no bus service on St. Nicholas between 3 and 5 a.m. You have to get to wherever you got to get to the best way you can. Trains often do not run overnight. They run once an hour or every half an hour. That's just not feasible. So we have to be realistic, and people should not have to pay. You should have to live in this community in order to get a parking pass in this community, but people shouldn't have to pay extra money. We already pay. Every time I get my insurance policy renewed, there is a tax. There's a city tax and a state tax. Every time I register my car, there's a city tax and a state tax. So we're already paying that. And we just need to be realistic. When you make recommendations about a community, you should at least know a little bit of something about the community. We already have this influx. All you have to do is walk up and down the street. You see Pennsylvania and New Jersey plates. You see people park their cars and get on the subway. You see them come back up here, get off the subway, get in their car, and drive back to Jersey. So we have to be realistic, not engaging in folly. And we have to be realistic about what's really going on in this community. Thank you.
Any
Victor.
response or Amir?
Yeah, thank you, Laquita, and thank you. Is it Monica?
Wait,
Thank you.
wait, 1 second. You spoke, Amir. I'd like to speak myself before
I
you.
would say Victor was next.
Is that okay? Thank you.
Oh.
Yeah, Victor, let everybody who had a hand up speak and then he can respond.
Thank you. I'm going to echo some of the remarks by Ms. Dula. I know people that live in Jersey. They come across the bridge, they park in Washington Heights, they park here where I live on Riverside, they go to the A train, they go downtown. We have the rack containerization program, which took 110 spaces away from a 10-block area. So now people are circling more. I have a neighbor who's a disc jockey on a local radio station, comes in at night at 11 o'clock. Several times she's fallen asleep in the car, which I've told her several times is dangerous. I said, try the parking garage on 153rd between Broadway and Riverside. She said, I did. It's completely full with a waiting list. I have relatives that live in Weehawken, New Jersey. They have residential parking there. It works. At 10 o'clock, I have to leave. In the mornings, I can't go in that area. You can't even make a turn to get into that area. So I'm in favor of this. A lot of people cannot afford an Uber. An Uber to the Bronx, where my family lives, is $40. I can fill up my tank for $40.
Right.
Everyone can't do that. I have friends that work in Staten Island and Connecticut. They have to have a car. And as far as congestion pricing, I think it will increase people trying to park in this area, which is already happening. You see the parking license plates, and I see people parking, walking to the train. I just think it's fair that we have this program. And for those who often said to me, well, you shouldn't be allowed to park on the street for free. I won't even say what I've said then. Every gallon of gas you pay tax for. Every
Absolutely.
gallon of gas you go at and is taxed. It's not free
Absolutely.
parking. We pay for that parking. So, like I said, I'm in favor. Not everybody could rent a zip card. Everybody could use an Uber. Working class people who live in this community, a lot of them need cars. I worked in Staten Island for years. For me to go there by train and bus was exhausting, and I had to do it several times. So I echo Ms. Dula's comments that people need to look at the population here before they make a judgment about who needs what. I'm willing to listen to everybody. I'm a bike rider, I'm a walker, I'm a runner, but I'm also a car owner. And I use all different types of transportation to get around. But when congestion pricing starts, I know we're gonna be out of luck. I can look out my window right now and someone's parked on a hydrant as I came in this evening. That's every evening. So just take that into consideration.
So I'll just point out quickly that the census data shows that in your district, 78% of people do not have access to a vehicle. So, just pointing that out in terms of the equity in the neighborhood and who does and does not have the ability to drive around. Those 78% of people are relying on, public transportation. So again, just thinking about the residential parking permit as a right to use public space, that 78% of people in your district are not then able to, use that space for other things. And so just thinking of the equity of like who does and does not have a car.
So what would you use that space for if a car is not parked in there? I want to just understand.
Oh,
that.
just
And,
could be
my other point
Um,
would be, do you know how many people in this community don't respond to the census?
Right.
Need to
I
look that
think
up.
there's a lot of, they put in a lot of different ways that they take the, the American Community Survey. It's not just the census that they get
Oh,
that
you
data.
said the census, so I was going.
Sorry, yeah, I mean,
right.
in broadly, but yeah, they have a survey every year and they have different things. But, I think also though, if you just looked at the number of parking spaces on the street, relative to the population of the district, it's clear that most people don't own a car.
So all these spaces that are out here full, who are those people?
Oh, well, I'm just saying that if there's only 5,000 spaces in the district and there's 200,000 people, clearly not very many people own a car, right?
Yeah, but more than 5,000 own cars.
Well, again, that was
So
Philip's.
there's no
I don't know
space.
the
So we're
exact number of
saying
parking spaces on
to
the street, but
accommodate-
relative to the population of the district as a whole, it's a very small percentage.
Yeah, but those people have nowhere to park, Sarah. That's what I'm saying.
Well, I'm
Why-
saying 78% of people don't have a car. So they're, the
So
public.
the percentage that does have a car have nowhere to park. That's the point I'm trying to get you to understand.
Right. Sarah, answer the question.
You can come any evening and
what's the
you can
question?
walk with me
Right.
any evening and I can, like when I came in, someone's parked on the hydrant every night in the bus stop.
What was the question you
everywhere.
wanted me to answer?
My question, I'm just saying that
She said answer the
people-
question. I wasn't sure what the question was.
Right. There are people in this district that live here that have cars. This community, most of the people that have cars are Black and Latino. We use our cars differently. As I said before, a lot of the people that live in this district that have cars do not work closely. And their only means for getting to work on time is their car. So I understand what you're saying, but you need to look at this community and the dynamic of this community and the dynamics of the people that own the cars here. I have a neighbor that works in Delaware. He has to be there at 6 a.m. If you think that he can take public transportation or ride his bike to Delaware, you are extremely naive, and I just can't believe that you would think something like that. I have
Well, first of
another
all, we'll say I
neighbor.
actually do live in the district, so I am a
Okay,
resident
I
as well.
have another neighbor that works he said it takes him almost 2 hours to get to his job in Connecticut. He
But so I
has
guess
to be
what I
there
would
at
say-
5.
I guess
So-
what I would say is that it's true. Some people need a car, but it would be to their benefit if fewer other people parked on the street, right? So that they could more easily find
But if
spot.
you live
But
here
when
and you
you
have
give
a
a
car,
parking
you should
permit-
be able to park here. That's the point. That's the point that Victor's making.
But
And
my
the
point,
point
though,
is,
is
a
that-
lot of the people that have cars parked on our street do not live in this community. And you know how you can tell? Because at night, when the people from City College leave and the people that park their cars and live and work downtown leave, then we can find parking spots. That's how you know.
You know, if I may,
Oh, wait,
You
one second.
know what, Heather.
Heather,
has,
yeah.
oh, yeah.
Heather had her hand up.
has spoken after Victor and then Amir.
Right.
Heather?
Yeah, thank you.
And let me just ask, can you, some time ago, someone on chat did indicate they could not hear anyone in the room speaking. Just, you know, give us a sign if there is difficulty.
I'm not sure
hearing
the owl is
person.
gonna be able to hear.
So just kind of address, just, you know, Heather,
No, because it will cause I'll
just kind of
present.
speak
But
in this.
Monica and Victor addressed many of the issues, but I just wanna just bring up a couple of other, thoughts that I have, that were not mentioned. And that is, there are a lot of, owner occupied property owners who also pay property taxes, for an example, who are unable to park in front of the homes, where they live in this district. People are sleeping in their cars, and it's not only people who are unable to find parking places who are housed. There are many homeless people in this community who have to sleep in their cars because they don't have a place to live. And there's a huge issue on my street in terms of people parking to catch the ABC and the D train to go downtown in order to avoid the, potential congestion pricing. That's on the rise. And then again, I agree, someone mentioned this earlier, but there's a lot of placard abuse, and especially placard abuse in front of fire hydrants. So there are issues, but there are a lot of complexities, and this there is issues like this going to be implemented. Then we have to take into consideration many of the special circumstances. That's why I take pause. I'm not totally against, but we have a lot of churches in this community, and people attend church services several times a week. And most of the people that are attending churches in our community do not live in our community, but they should be able to attend church and park, out in front of the churches. And this is Saturdays, Sundays, Wednesdays, Tuesdays, where they provide a lot of services to this community. So we have to think about how we will be able to accommodate people who attend church services. There's a lot of arts programs and initiatives in this community where people are coming outside of our community to attend certain events, who would not have access to parking if they did not have some type of parking permit. So there's just a whole diversity of issues that would have to be considered before we undertake something like this. It is an issue, but this community has a lot of special circumstances that have to be considered. Those are my comments.
Thank you, Amir.
Yeah, thank you, Heather
And
and
then
Laquita, thank you. I actually appreciate naming that, that some of the complexities here, because I think, the Regional Plan Association has really come out on record in multiple statements saying that residential parking permits as it would theoretically be managed in New York City would really significantly affect commercial business. It would affect West Harlem business owners who live here and work here and own businesses. But beyond that, I mean, I think the first thing I'd like to say is, as articulated by the chair and by Ms. Dula, I'm sensing a very significant disconnect between the rhetoric in support of residential parking permits, which really seems to be motivated by the fact that I don't like seeing Jersey and Connecticut plates here and there. I should park here and I should park for free. I sense a significant disconnect between that rhetoric and the information as declared in this resolution, which seems to really make dubious claims about better environmental health outcomes. We are the Health and Environment Committee of Community Board 9, a community board district in which nearly 80% of its residents do not have access to a car. I'm one of those residents, and everyone's naming anecdotes about someone that they know. Well, I know lots of people like me who don't have a car. I rely on public transportation, and I think relying on public transportation is a good thing. That produces better air quality and better environmental outcomes. Our community board district trails the citywide average for bus lanes. We're 41st out of 59 community board districts for bus lanes. We trail the citywide average for protected bike lanes. We're 44th out of 59 community board districts. A vast majority of people who live here do not have cars. I live here just like most of the other folks on this call, and we look at every train and bus station here. They're very significantly used because obviously a lot of people here do not have access to a car, and that's supported by census data. I think the really, and according to Spatial Equity NYC, 64% of commuters in our community board district take public transportation, while only 5.5% of commuters in our community board district drive alone to work every day. 5.5%. So I think I'm obviously very clearly against the principle behind residential parking permits of privatizing the public right of way for permanent car storage. I don't think we discourage car use by doing that. I think we incentivize it. That's going to make air quality worse. If folks on this community board want to say, I don't want to see Jersey plates on the street, I don't want to see Connecticut plates, I want to be able to park on the street for free, then I think that should be the writing on the resolution, not claims that it improves the environmental health of our district that is not supported by any research or data. And you just heard two presentations from Open Plans and Transportation Alternatives. I also shared other research from the Regional Plan Association about this. Virtually no urban planning organization in New York that shares the environmentalist goals that our community board has supports residential parking permits. There's no advocacy from any of the planning organizations behind this. I think if folks really want, are upset about seeing Jersey plates on the street, then that should be in the resolution, and it shouldn't be in the Health and Environment Committee. It really has no place. That kind of rhetoric has no place in this committee.
I'm sorry, but I could not disagree more. That's because I don't know where Open Plans, I don't know where they get their data from, but data is great. But the problem is data does not deal with the day-to-day of this community. Does data cover the fact that there's no bus on St. Nicholas between 3 and 5 a.m.? Does it cover that? Well, people have to, I found that out because I had to go to Mount Sinai and I had to be there at 5 a.m. And I found out the ugly way that there's no bus. But there are people on St. Nicholas that work every day. And they can't take the bus and they can't take the train and they gotta drive or take Uber. So we cannot be naive about the realities. We don't have bus lanes. Neither 145th Street nor St. Nicholas nor Amsterdam could support bus lanes. And they can't support bus lanes because St. Nicholas is the feeder to the George Washington Bridge, and so is Amsterdam. Amsterdam is a street that first responders have to take to get to the bridge. It has been designated by the city. So, we have to be more evaluative, that's a word, of what's going on in our community and understand why things can't exist. In terms of people parking, yes, residential parking will save us because we won't have all those cars coming into our community. That's great. All these transportation people, they want everyone to use public transportation when our public transportation system really doesn't work and really doesn't fulfill the needs of people who don't work 9 to 5. So if you work from 4 a.m. to 1, how are you supposed to get to work? Or if you work way up in Connecticut, or you work way up in Massachusetts, or you work way out in Pennsylvania, or you work way down in Delaware. Unfortunately, our neighborhood isn't the kind of traditional one. Most of the people don't work hybrid, and they don't work remote. They got to physically go in for the people that live here. In terms of spending money to park, that is a serious burden on middle-class people who are trying to just survive. And I think that's another thing that these groups don't understand. Not everyone has the leisure of having an extra $75, $80, $100 a week to pay, coin parking. So, you have to be, you have to get outside your box and look at the box of the people that actually live here, the lost, the least, and the left out, the people who don't work remotely, the people who don't work hybrid, and the people who did not come from a place where they have lots of money. Because $80 extra a week is too much.
Could I just add two things?
Let me just say that, yes, we need to wrap up the segment and have bring it to a close. Obviously, there's much more to discuss. Our guests, Sarah and Philip, if you have something to wrap up with, that would be great.
I'll just quickly say, you mentioned that you don't have any bus lanes, and that's obviously, Amir pointed it out too. That's really bad for, again, the majority of people who use public transportation. And one of the reasons why it can be hard to put in a bus lane is that it's impossible to take away parking. So it becomes a vicious self-fulfilling cycle that it's hard to get the good public transportation you need if you're doing things like putting in place residential parking permits. I also wanted to go back to something Victor said. He pointed out in, I think it was Weehawken, New Jersey, they have the parking permits, and he said, I have to leave by 10 p.m. And that's because a lot of times the parking permits are for overnight parking. And you pointed out that, the students and the people who are commuting in, you can tell they're doing that because they leave by 10 p.m. So the problem you're talking about, them coming in and parking, wouldn't necessarily be addressed by a residential parking permit system because it would only apply to overnight parking when those people aren't parking there anyway. And then I also just wanted to point out that car ownership is an incredible financial burden. Next to the housing costs, it's the highest financial burden for low-income people. The cost of gas, the cost of insurance, the cost of maintaining a car. When a car breaks down, it can be, incredibly damaging to a family that's living paycheck to paycheck. And so helping people not have to be dependent on cars is actually really, really good for middle class and low income people. But that's all I have to say. I do have to run because I have my kids, but thank you so much for having us. And it's a really important discussion. I think a lot of community boards around the city are having this discussion. It's not just you all. It's something we definitely are going to be talking about probably for some time to come. So I really appreciate you inviting us. Thank you so much.
I appreciate your being here, Sarah and Philip. I'm not sure, Philip, if there was anything else to add. And I thank Amir again for pulling this part of it together for us. There is so much to discuss and there's a lot to think about on both sides. But I know that something is going to happen in the city and we need to be a part of it, and we'll make I'm sure a wise decision based on our community so that we are acting and not acted upon. So it just means more thinking about it, more discussion, and trying to be, have some vision and open-mindedness about it. Thank you both again, and thank you, Amir, as well. I know that took up we knew it was going to take up a chunk of our evening. It was an important discussion. I am hoping that Pauline Ferrante is with us. Pauline is back from a leave at New York City Department of Health and Mental Health. Pauline, are you? Is Pauline here?
I can't tell. I'm looking.
She is usually one who will.
I mean, I see, there's an iPhone, but we don't know who it belongs to.
Carmen, do you know, let's see, I see Carmita.
Yeah, Carmita's.
Carmita, are
I'm
you?
not sure either. I've been looking to see if she's one of the iPhones, because she is back from maternity leave.
And I'm not sure if you were prepared to discuss anything, but we knew that she was away for quite some time. And I was really happy to hear that she was back and was hoping that she would be able to touch on early infectious diseases. That's what we asked her about better than a month ago, because there's been so much that has come up in reference to COVID, RSV, the flu, what's going on. You know, as we mentioned in one of our other meetings, incidents of measles, and even malaria, which was a surprise. And, you know, it's not at a scary point, but we need to know what's happening and how the city's dealing with it, how the department is dealing with it. I don't know, there's some insight you can provide, Carmita. Like I said, I don't want to.
No, sorry, I wasn't prepared. Pauline was bringing the information in and I was coming in to just support her, so I apologize. I don't have anything. Credo, we can follow up with her after the meeting to see what she can, communicate for us.
Or if if you have another way of contacting her, because there are two iPhone persons here, and I'm not. I would think Pauline would speak up. I'm accustomed to that.
Agreed. Yeah, agreed.
Okay, so we'll move forward, we'll move on, and if she shows up, then we'll come back to her. The New York City Climate Dashboard, I know that the Office of the Comptroller, Brad Lander, is very excited about that. He made a big announcement back in September. So we plan to have Stephanie Fox, who wrote us, to speak at that time, speak at our October meeting. And there was an unexpected incident with her, so that she wasn't able to speak then, but she is here this evening. And so we wanted her to talk about tracking the city's progress toward meeting its goals of reducing greenhouse gas emissions 80% by 2050. That's something we, all look forward to. And Stephanie, thank you very much for joining us. Do you need to be made a co-host?
Yes, please.
Okay, let's see here. Oh, that's right. I'm at the wrong Hakil. Yeah. I'm at the wrong computer. We need to make Stephanie Fox a co-host, because mine, when we didn't set up mine for that. Oh, Stephanie Fox.
You should make her a co-host as well, Laquita.
Who?
You should make her a co-host.
Yeah, see when he was running back.
That way you'd be able to do it.
Yeah, let's just get Stephanie done first. So. Okay. Ready, Stephanie?
Yes, let me share my screen real quick.
Okay, now you do it.
Slideshow. Oh, here we go. Hi, everybody. My name is Stephanie Fox. I'm the strategic organizer for climate and environmental justice at the Office of the New York City Comptroller, Brad Lander. Yeah, just gonna try to run you through this. This is actually a longer training as part of a more detailed look into our climate dashboard. So I'm just gonna go over things fairly quickly here since we have limited time. But yeah, basically I want to show you a little bit about our dashboard and give you a little bit of an understanding of what our office does and some of our priorities around climate change. So I'm part of a team.
And I'm sorry to interrupt, we had stated that at another point, we can put together a segment of the community for the larger training and of the
Yes.
community as well. So this was always meant just to, give us an overview.
Yeah, right. Yeah, so I'm part of the Comptroller's climate team, which consists of me. Also consists of Louise Young, who's our first chief climate officer. We also work with some asset managers who focus on the financial side of our green investing. We kind of look at the environment through a few things, specifically through a just transition lens. And part of what our exploration was when we were trying to figure out like how we want to be more transparent with the wider New York City community about climate information was we wanted to figure out ways that we can show the community how they can utilize data in their environmental justice work and kind of show like how climate and environmental issues interact with different social indicators. Let's skip over this as part of the bigger things. But yeah, you all know that 1 second. That climate vulnerability doesn't really impact everyone equally. There's different aspects like physical exposure, sensitivity, and capacity to adapt that impact people differently, including people that are within the same city. There's of course also racial disparities. One example is if you look at maps of redlining and you look at maps of current heat vulnerability, you're going to notice that there's a lot of overlaps. Now that's concerning. It's one of the things we kind of want to be able to show people. So a little bit about our dashboard. Oh, skipping through some of this stuff because oh no. Getting back to it. Yeah, so our dashboard. You can go access it through our website by clicking here. We have a couple of things we show. We have a little bit of an about section. We have a section on energy. It shows a little bit about what our current power mix is and shows some of our goals toward installing solar in New York City. We also show emissions, where you can see our annual greenhouse gas emissions. You can also see them broken down by sector and like transportation, waste, or buildings. And you can break that down even further down here. We also have a map of benchmark buildings, so you can see how buildings are doing in your community. We also have this climate finance page. This climate finance page actually is keeping us accountable. It has to do with, have people here heard about our net zero plans for our pension systems? Basically, in 3 out of 5 of the pension systems we have in this city, they made a goal to go net zero by 2040. So we've put together a plan of how to get there. And this is just us tracking our goals and our commitments, so you can hold us accountable. We have a section also on environmental quality. This section is actually our newest section. We cover air, water, and land pollution. So you can actually look down and see, this is air pollution. You can see what different kinds of air pollution impact different parts of the city. You can do water, so you can see where lead pipes are, and you can check out drinking water quality. We also utilize a map layer called environmental justice areas. So you can see how basically various environmental justice issues impact environmental justice areas and see how they interact. In some places, it's quite obvious how they interact. We also have land. We show people where bulk storage facilities are and brownfield cleanup sites. You can also click on each individual one to find out more information about that so you know exactly what's in your neighborhood. We also have resiliency. This covers things like coastal flood risk, where we have maps that show what coastal flood risk is going to look like now and in the future.
Excuse me, I think the slides aren't advancing along with you.
Unless something's supposed to be happening on this slide.
We're stuck on New York City climate dashboard.
Right.
Yeah.
'Cause I'm looking to
Oh,
see some of
okay.
these-
Let me see. Hold on one second.
Yeah, it looks frozen. Yeah.
I'm glad you said that. I thought.
I thought
Can
the
you see it
actual
now?
map- Yeah, it
Yes.
just moved.
It
Yeah.
just moved.
Oh.
Okay.
Yes.
Okay.
Knew it was
Yeah,
stuck.
sorry, some technical difficulties there. I had
Yeah.
walked y'all through parts of the cloud dashboard. This is the energy section, the emissions section,
Okay.
climate
You said-
finance section.
Lead, you said something
So you
about
can actually
lead?
see more about these things. Yeah, that was under environmental quality. I'll start back there. So you can see under environmental quality tab, you can check out air issues, water issues, and land issues. So air issues shows different kinds of air pollution. We show maps of the city and like how different air pollution impacts different parts of the city. So you can see what kinds of patterns. This is over the course of an entire year. Some people sometimes ask about our the air quality issue we experienced this summer, specifically with particulate matter from the wildfires. That was a one-day issue. This shows issue over the course of an entire year. This is the same kind of pollution that incident brought about. That's particulate matter, but shows where the particulate matter is usually concentrated over the course of a year.
Is that data provided down to the community board level?
Yes. Oh well, actually, when it comes to air quality, this is
Yes.
just an overlay of the entire map, but you can see what's it called? Certain districts outlined here. Most of our maps are more granular than this one, but this one we don't have a more granular map than this. For instance, if you look at, water,
Be available to us as,
At the community board.
at the community board level, right?
Community district level.
Or
when you're talking about specifically this air quality map.
Any of the data.
Any of the, yeah,
Any of the data.
air, water.
No,
Lead.
so some of it is, some of it isn't. When we're talking about the air quality data, that's not available in a more granular way. It's an overlay map. But when we're talking about the water and land, yes, that is very detailed, very up close, very. You can like look down, and you can see the street level. You can see exactly where things are. You can click on them. You can interact with them. So yeah, for water and for land, you can see that. For water too, there's I'm not gonna get into too much detail right now, but something interesting is this is actually a map of every single lead service line in the entire city. So it's one of the more granular maps we have. So you can actually, not only is this down to the community board level, but this is down to the individual building level. You can actually click on individual buildings and see if that building has lead line or not.
Oh, wow.
One of our more powerful tools.
Yes.
Yeah.
And then there's also land. This is also pretty granular as well. You can actually go down to local levels. You can see local brownfield cleanup sites. You can click on them. You can see exactly where they are. You can see exactly what they're holding. You can see exactly whether or not they're completed or not, or in the process of being completed. You can find more information about the specific project here. So you know exactly what's in your neighborhood, when it's supposed to be cleaned up, if they're doing it, who's responsible for it. This way it empowers your community to be able to advocate for itself. And part of being able to advocate for yourself is knowing what's in your community.
I was interesting, under land, well, you moved it now, but, it showed where all chemical storage or something
Yep.
like that. Oh, here it
Bulk
is.
chemical storage facilities.
Yes. Across the city.
Wow.
Yep. So these yellow dots are all bulk storage facilities. So you can click on them and it'll tell you what's there. For instance, this is a water treatment facility that includes municipal waste. Or if you click over.
The one you clicked, is that district, let's see, now I have to look at the map. Are you in District 9 when you point to?
The last one I pointed to was not, no. I just picked a random thing to click on.
Okay.
Hmm.
Very
Very
interesting.
Yeah. And then there's resiliency. Resiliency shows a couple different things. First, we have coastal flood risk, which will show you what parts of the city are at risk for coastal flooding at a pretty detailed level. We also show how this will advance over the course of the decades. For instance, you can see the 2050s all the way through 2100s. And you can
Well,
see
even
kind
in
of how they're
District
interacting.
9, Stephanie, even in District 9 with the last huge rains,
Mhm.
there was more flooding noted or being warned, flash floods warned about. And this was almost unheard of some years before. What
Yeah.
does it portend? I mean, is there anything in our district beyond what we saw with our own eyes that portends an increase in flooding? Just a
So
question.
this is coastal flood risk. This has to do with rising seas. If you're talking about flash flooding risk, that's another slide. We also do have that. So this is flash flooding risk. Let me let it load for a sec. This is various rainfall flooding scenarios. We have both moderate stormwater risk. For instance, if it's a medium rain, these are areas that are likely to flood, and extreme flood. These are areas that are more likely to flood. So you can kind of see areas that are most at risk. And you can see there's parts of the community district that are at serious risk for both moderate stormwater flood and extreme water flood. And we also do show where the DEP is investing in sewer capital projects for large scale draining. And we also show green infrastructure. Green infrastructure are different ways that we try to find ways to divert water away from our sewer system that help them basically absorb into the ground quicker. So you can look at these and you can see what kinds of structure they are, and if they're currently being built, or if they're already, or if they're planned, or if they're under construction. So you can see kind of what's in your neighborhood. And we also show where combined sewer overflows are, and we also allow you to use the environmental justice area map overlay as well to see how those interact. We also have heat risk. So you can see where our city has the most heat vulnerability. I always find it very interesting to look at the heat vulnerability index compared to vegetative cover, because you're going to notice that they're exact opposites. And you're also going to notice that with environmental justice areas and vegetative cover tend to be exact opposites as well. And I think that says something about what neighborhoods are getting fair treatment, which ones aren't. We also have community preparedness. This is just a little bit of resources you can look into to create a disaster plan, doing an emergency planning toolkit, getting some preparedness training, or developing a continuum of operations plans for small businesses. And last but not least, we have the feedback form. This is just if you have any ideas, you can send them on here. It actually goes to my inbox, so I'll see it myself. With that, I will take any questions.
This is fascinating, and I can see why you guys were very excited about this project. What is available through a link? Is that something you could put in the chat? Unless I missed it.
Oh yeah, it's on our website. Let me link it real quick.
If you could just put the website in the chat, that would be great.
Will do.
And
if folks want a more in detail, it's called training on this. I offer those. They take about an hour. I'm glad to do them anytime, anywhere. You have people that are interested in learning more about climate data. I will teach them how to use it.
We promised that. So what we need to do, Stephanie, is just come up with, we'll see here, or we should just talk about possible dates, maybe several, and then send out a mailing to get the response. And of maybe a choice of 3 dates. I missed your presentation at WEACT. Was that one about an hour?
Yeah, it was about an hour.
Okay, but I missed that. because, yeah, I was in town for it, but I somehow I got to that meeting after something else that, I had to do. It was on a Saturday. But it could be planned in conjunction with them for any of their persons who missed. We'll get a location together. And how large of a group can you provide a training for, or is comfortable for this kind of
You give me 5 people, I'll train 5 people. You give me 500 people, I'll train 500 people.
Okay, are there any questions? I don't see any hands or comments.
Sorry, I have a question. Can we have Miriam from New York State Assembly Member O'Donnell's office? Stephanie, is it fine if we have your contact info?
Yeah, of
I would
course.
love to reach
Let
out.
me put my email in the chat real quick.
Thanks so much.
All your contact data in chat. Any other
That was all.
comments? Thanks, Miriam. Any other statements or questions for Stephanie?
She's gonna share the link for the website?
He put the link in there.
Okay,
Share.
it looks like it, thank you.
Yeah, the link is in the chat.
Okay. I wanna save it. Yeah, it was very interesting. Knowledge is power, so.
Cool. Any other questions?
No.
I don't have
Looking.
Cool. Well, thank you so much for having me. And yeah, feel free to reach out with any questions or ideas you have. And if anyone wants to create a training, let me know.
You have my contact information also. Will you please just send maybe possible dates in toward the end of November? And
I'm absolutely flexible. You send me some dates that work for whoever you'd like to train, and I'll see what I can do with them.
Okay. So we'll work.
It's literally my job to be accommodating for these things.
Okay, thank you so much, Stephanie.
Thank you so much. Thank you so much for having me.
Bye.
Let's see, okay, let me see what else is here. Moving right along. And I don't think Pauline has shown up, and I kind of think at this point, oh, wait a minute, there's someone, OTIAB. Okay. I don't think she'll show up at this point. She's also a new parent. So, I'm sure at this particular time, that's also some juggling. We have our member of the committee, Clotilde, who is who's on Zoom. Clotilde, hi. Clotilde has come back from 2 very exciting conferences, and I've asked her if she could share a little bit of time, maybe 5 minutes, just about to cover both conferences. One was in London and one was in Saudi Arabia. So Clotilde, if you're there, take it away. You have to unmute. Unless you are unmuted and I'm not.
No, she's not.
Okay, Clotilde.
Can you hear me? Can you
Uh,
hear me
yes,
clearly?
yes.
Okay, so thank you for having me. I'm still, it's like 2 o'clock in the morning. I'm coming back Wednesday. So I did in.
Not here in person. You're where? You're still in. Where are you?
Yeah, I'm in Belgium now. I'm coming back on Wednesday. Yes, that's why I'm online today.
Wow.
Yeah.
Okay. Well, that's
Yes.
a good reason for not being here.
Yeah.
So you're here and we're happy to see you. So let's just move forward though about starting the conference in London and then move on to
okay. Yes. So I attended in London the ASCA 2023 conference on sickle cell disease and thalassemia. And it was held from the 24th, I think, to the 28th of October. But before I talk a little bit about what we discussed at that meeting, for those of us who are not really aware of sickle cell and the relevance of that disease within our community, I want to briefly tell you what is it. So the sickle cell disease is a genetic blood disorder which affect the shape and the function of the red blood cell. And red blood cell carry oxygen. So usually the shape of the red cell allow the red cell to circulate very smoothly within the vessel. But because of that genetic disease, the new red cell is characterized by an abnormal shape, very rigid, like a crescent shape. So those deformed cells, they really block the flow, and that lead to excruciating pain, hand organ damage, and a lot of other health problems. This disease is inherited, and it's primarily affecting African Americans, Mediterranean, Middle Easterner, South Asian descent, and let's even mention India, where they have about 10 millions, which I didn't know. So it caused a lot of symptoms and complications, including anemia, severe anemia, pain crisis, lot of risk of infection. As of the treatment, as today, even though for century we haven't done anything when it was discovered early last century, now there's a tremendous involvement around sickle cell. For now, the current standard of treatment is called hydroxyurea. This medication helps to increase the production of fertile hemoglobin that reduce the crisis and also alleviate the symptom. We have blood transfusion. We do have the bone marrow and transplant. We have a new therapy called gene therapy. And we do have something new. I will talk about it more when I will be back in the state, called gene editing as well. So why is relevant here in New York? Because it affects mostly African Americans, and we know about the demography of the District 9. And it's important because it's really not very well known by the communities, by the health professional. It is essential for us to address the issue of information, awareness, accessibility to the care. Not only any care, but I'm talking about the quality of health care. And also it has to be done in specialized centers. We have too much issue when you go to the ER, when our warriors, how we call them, arrive at the ER and are called all kind of name, escorted by the police because they think they are drug seeker. So we need to improve the support of services, including psychology, social support, housing support as well. I mentioned about education advocacy as well. Another things that we discussed during that meeting is the ongoing research and the trial, clinical trial, very important about that. There's a lot of new treatment on the pipeline with tag cost of $2 million. You are not cured, but that will alleviate the pain and the symptom. So when we talk about those tag costs of $2 million attached to the care, we talk about accessible in health insurance as well. So that meeting was held in London. It was beautiful. We held the meeting at the County Hall, just opposite to the House of Parliaments and the big bands. It was attended. It was organized in conjunction with the European Hematology Association, the British Society of Hematology, and for the first time, it also joined the sickle cell in Africa. A lot of sponsors were there. Pfizer was there. It's very important to say as well that the Lancet had a commission, and they had issued a booklet that I'm going to be bringing back as well, with a lot of guidelines as well for professional as well for the civil society. So this is about London. So we do have a lot of resources here in the United States as that, but the information has to circulate a little more, not a little bit, but really more. So when we, as we have our healthcare fair coming on, we will discuss a little bit more about that. As of the Saudi Arabia, it was scheduled. I say it was scheduled, but I don't have to explain to anybody based on what's happening. It was a meeting on healthcare between Americans and the Middle East, and the organizer of the meeting just rescheduled it to better day in April of next year. But we do have at the end of this.
What was the topic of that one? The one in Saudi Arabia. What was the topic?
So that was a platform for investor, it's all in healthcare. And during that meeting, the subject that I was about to discuss was about accessibility, but it was about the role of AI in healthcare, and also the role of cybersecurity, protection of data, protection of and confidentiality. And as I go to those conferences, I always bring the perspective of underserved population. Getting back to London, it was not only the European perspective. In the attendance were a lot of Americans that I met here in Bethesda were there, but this year particularly Africa was very well represented, and India was there too. They are often overlooked, but they've been coming now, and they show us that they need to be accounted for. So there's still a lot of gap, a lot to be addressed, but the good thing is that the pharmaceutical firm have seen an interest, and I'm hoping that that will resonate in order to bring more accessibility, more equity, etc., for underserved. This is back to you, and you will see me soon in person by Wednesday.
Yes, I thought you'd be back. That wonderful reporting. It sounds like there was a breakthrough with the clinical trials in London on sickle cell. So,
yeah, I wanted to say that once again here, I will stress, and we discussed about that, how important is for our community to trust and to be part of the clinical trials.
Yes, that's what our committee has been working to provide presenters to the committee, and give us something to encourage possible participants. And I know that some participants that have visited our meetings have signed up for some of the clinical trials that are taking place at Columbia University's Irving Medical Center. So we hope to have a bigger forum for that, as Dr. Clotilde made mention of at our public health forum. And we haven't talked about that. Hopefully we'll have a little time before the meeting ends, but that's scheduled for February 10 at the Columbia Forum from 11 to 4 on that particular Saturday.
Excuse me,
Mhm.
Laquita, what is the sickle cell rate in our community board, and where do we rank nationally?
I don't, Dr. Cotel, do
Yes.
you have specific?
I don't have data yet, but this is exactly what I'm waiting for to go and pinpoint about the prevalence. And yes, it's very, very interesting when you provide, when you have to share resources based on the numbers of our patients, so you will be able to have more resources. So it's very important that we know how much, we know where they are located, so that we can provide the services. In fact, during that meeting, we stressed a lot about providing care, but not only just care, but culturally competent care that take into account the diverse background and experiences of the patients. So we can expect to see African American at the ER, but you also can expect to see an Hispanic. You can expect to see blue eyes, blue eyes and blonde, just because of marriages, and because we don't have, we do and not do the newborn screening. I didn't talk about that yet. We don't have registry, so because it's genetically transferred, you don't know who has that. And we know now also that it affects Indian population over the millions. So we need to be very cultural and competent, train people who look like us, who are compassionate, who can listen about what the patient has to say, and not just say, we know, just wait and we will see, because that requires very specialized centers and very specialized treatment care. So back to you.
When you are back, let's see, in the chat, Monica also mentioned something about testing is often done at birth. I know those who know they have the symptom, they make a point of making sure their children are tested. I know that just generally from, families. But if you can provide us more information that we can then, maybe we can have a forum, or that definitely, as you mentioned, will be part of the public health forum, but maybe there's some additional information we can get before then.
Chair,
Oh, is it?
I have my hand up.
Oh, money.
I'll be quick. Yeah, I was just I thought, Clerk Till, thank you for your report. It was very thorough, to say the least. And, hearing what you said about sickle cell and the clinical trial, I am very excited to see what more information you would bring around that. And of course, the importance of increasing education, awareness, even among our healthcare providers. The fact that what struck me, what you said, people coming in and presenting in a particular way because they're in pain, and yet they're being perceived in a negative way, and then probably treated as such. So definitely increasing awareness among those who are providing care, so that they know how to treat someone who's coming in and having an episode, treating them in a respectful and appropriate way, and not assuming the negative. So I appreciate you sharing that. I look forward to hearing more when you come back and incorporating that as a part of our health forum. So thank you.
Any other statement or question? I don't see any hands up among our any of our participants right now. Thank you so much, Dr. Cotel. And actually it's Dr. Manguya, and her first name is Cotel. Member of our committee. Thank you. The next items are under new business. I need to report that very fortunately, we were able to participate in the budget hearing several weeks ago. And I want the committee to know that we dutifully submitted our feedback, our suggestions and comments and where we felt our budget concerns should be directed. And we offered a couple of new items that I want everyone to know as well. We certainly supported the items that had been in the budget prior to the meeting, which involves a lot of training, supporting the training, education, making the public more aware, and making sure that at DOHMH there are persons who can go in the field and talk about some of the health issues that are plaguing us, some of the benefits that have come maybe from some of the healthcare programs underway. We need to make sure that at least there's money there to support those as priorities. Two additional things that were added dealt with construction and renovation. And I reached out to 4 of our healthcare facilities in the area. Not only Emma Bowen, Community Service, but Heritage Healthcare Center, the Ryan Center, and the Charles Rango Healthcare Center. I talked to 3 of 4. Ryan at the time wasn't ready to, hadn't done the kind of assessment where they could identify something specific that they wanted. So they're holding off until our next round, and that, of course, that next year. But Heritage Healthcare put in a request dealing with their renovations from their move from 1727 Amsterdam to a location that they currently have that is under renovation to accommodate what they did have at 1727. And so they fall under the capital plan as well as expense. There was a request related to, and I'm doing this off the top of my head now, equipment, chairs, communicating mechanisms like through monitor, a whole system that allows them to speak to the patient inside, as well as they have these big window displays, the opportunity to communicate externally to the public as well through their camera. And then there were some other design renovations that were part of that. The Emma Bowen Center has a security system as part of their request, as well as a mobile van for the transporting of handicapped individuals to the facility and back. So we put those in writing, and we'll just see what comes of it. And first of all, internally through our community board treasurer Deirdre and Barry, who has extensive experience over the years working, help us with this budget process in Utah. We'll hear if there's anything else that's needed, but I believe that what was submitted was appropriately done. First of all, that's the key. And hopefully we'll be able to help our community, and particularly our healthcare institutions that are pretty big and have been around, those for a very long time. Any other, let's see, let me check the chat. I need multitasking here. I want to go back to something, that I missed in the chat, maybe, I'm not sure at what point it, and I apologize, I missed it. Dr. Reinstrom, asked, let's do sickle cell testing at the health fair. So I'm not sure if Dr. Reinstrom is still on the phone, Yana. But, Dr. Clotilde, do you mind when you get back looking into that part of it, just doing, that aspect?
She's on.
Yeah, I'm
Yes.
here. Sorry, yeah, I've been retired for 7 years now, and I think I forgot, yeah, it's true that people with sickle cell actually do have symptoms. So maybe the testing is not so necessary. I also know that we always test in pregnancy, so
Well,
just thought that occurred to me, and I quickly put that in the chat. But it was a great presentation, Clotilde. Thanks for doing that.
You're welcome.
yes, I think it's still a good question because we have we're planning on doing a maternal welfare, wellness segment as well. So that certainly could come up there. In addition to other things being discussed, related to, the child, healthy child.
And
let's see, then
if the
mine-
testing is routinely done as part of prenatal care, we know in our community board district, many people are, confronted by barriers seeking prenatal care. Because of our racist medical system and health infrastructure in this country. So, perhaps, that's worthy of consideration too. And I actually know that kind of prenatal care, that these barriers are getting worse. I think a lot of people are worried about the weaponization of substance use screening results that are done as a part of prenatal care, weaponized against pregnant people, which triggers child welfare investigations and child abuse. So all of these systemic and structural problems that drive people away from prenatal care might have implications for sickle cell diagnoses.
You heard that, Dr. Clotilde? There's some good ideas coming out of this.
Oh, yes, I hear that even more. And let's talk about gene editing. Last week, the FDA approved a new drugs. I cannot really comment about that because I don't know too much, and I would call an expert with that. In that meeting, we talk about ethics. The whole continent of Africa, we are so scared because when we talk about gene editing, we almost playing God here. We don't know. We don't know what's going to happen.
Right.
Yeah.
Yeah.
We have to find a way to, how we want to present that, but it has always been an aspect of the public health forum, those, who were part of our meetings, which will resume again very, very soon, because we have to, just a response to that, you're absolutely right, Dr. Clotilde. And, we've started asking, for some of the testing vans and screening vans. Dr. Milano has already reached out to Columbia University for, the mammogram van, I think for colorectal screening and for the dental. One van that or bus that I know we will have is the bio bus. That is is wonderful, with Dr. Christine Marizzi. She was introduced to us by Deirdre Brown. And she's come to our meetings and she participated at the Family Day sponsored by Columbia University, where we had several tables for not only the community board in general, but the health committee and different ones who could make at short notice a Saturday afternoon for distributing brochures, pamphlets, and they had, different other kind of giveaways that entice people to come and hear about a health spa. It was very interesting, and then there was also a program dealing with young people and mental stresses. So they all had about 6 organizations had a chance to participate because of our involvement with that family day sponsored by Columbia University. So the February 10th, we're looking to be huge. We got to get our community there, and we're going to be doing a lot of promoting. But there's okay, let me just see if I missed something else. I think we touched on the key points. And in the chat, there's a conversation that we can follow as well, the importance of being diagnosed. And our sympathy goes out to Monica. She mentioned her godbaby died of sickle cell at the age of 3. So there's so much, and so the focus. Let me just say at this time too, that the focus of our health forum, I call it a health forum. There's a health fair component to it, but it will be largely centered around clinical trials and research, which I don't think has happened as much in health forums in our community. So we have a little bit of a different twist and necessity to get out, a desire to get out information and some good news information, breakthroughs and research. We've done that this year in our community. There have been about 4 presentations just on research trials. So, we've kind of set the pace, and we'll pick it up for the public health forum. Was there someone else? I don't see their hands up, but if someone wants to say something, feel free to.
Laquita.
Yes, Victor.
Have a small bit of new business, if I may.
Okay.
At the Landmark and Parks meeting, we were informed that 5G towers are going to be installed in the district, and they're talking up to possibly 85 5G towers. They would take the place and incorporate the NYC Link kiosks that you see on the streets now. There's a comment period that's very limited, so we can talk afterwards. I'll probably go over it again at executive board meeting, but I'd like your committee to work with Heather and Annette on this topic. One of the ways we can defeat some of this is by using our historic landmarks and just pointing out that these huge towers that could be anywhere from 18 to 30 feet tall will ruin the landscape of our historic district. So I didn't want to take up too much time with that, but it is important.
Well, that's important, Victor. Thank you, because I didn't know that it come to, we've been so swamped, and I keep in touch with Odette, and I see she's on online here with us. She's been coming to our meetings, and I was hoping that we had a couple of people who could, and I knew Heather has been going. So
we can talk about it at exec meeting. I'll bring it up more, but it's an important topic. Like
yes,
I said, pushing forward with it, despite all the reports about the radiation that's given off by these towers. So just wanted to put that in there.
And we were also, I'll say the community board, our committee brought a resolution opposing the 5G towers as presented earlier this year. So we've been trying to be on top of it. And Odette had said that everything is going to move so fast, and it'll be like, wow. Yeah, and that's exactly what's happening. Odette, are you?
Laquita, did that resolution go through general board?
Yes, it did.
And so we passed it already.
That part of it, yes.
General board.
Okay. Yes, I think it was January or February.
Because I was wondering, so we don't need to do another one.
Well, I think this may be different. I'm trying to see if Odette is still close by. Odette, she's here, but I'm not sure if she's.
Is she able to unmute her? Does she
Can
need
you,
to be?
let's see, ask to unmute? Odette, can you hear me? Can you unmute? She stays so busy, she may have stepped, wait a minute. Ah, wow. Let's see if, she knows how to unmute, but she's been busy on the phone and she said that she would come into the meeting.
She's been just dealing with this issue probably. Yeah.
Yeah, she's been doing comments. She's somewhere. I'm not sure how plugged in.
Okay.
Let me just quickly see if I can reach her by phone.
So, well, we'll talk more. Well, you said, Victor, they're supposed to replace the link kiosk, LinkedIn kiosk? I said LinkedIn, Link NYC kiosk?
Yes, they're gonna incorporate the LinkedIn kiosks with these 5G towers. So at the base, I'm imagining they'd have the kiosk, but up above it, they would have 5G towers.
Wow, so people would be like directly under those towers as they're using the kiosk.
Well, not only that, they'll be directly outside people's windows.
That
Because
too.
here on
Yeah.
Broadway, we have two, and then, you know, one block after the next, and the person's window 15, 20 feet away. So
Yeah.
it's pretty close.
Yeah. Got it.
Yeah.
There's a lot.
Hi, Odette.
Okay.
Odette Laquita, I know you're on your other line. If you can join us on Community Board 9 as quickly as you can, rejoin us. Okay, bye. And Odette had mentioned that there were people who had suffered, what is this, her calling back? Oh my goodness. Anyway. Hopefully, let me see if I can ask her to. Odette? Seems like she was calling me back. Okay, so.
Whoa.
I don't know, that was, Odette, but I'm not sure if she's, anyway, if she just watches the screen.
Okay. You want me to type a message to her?
If you will, that'd be good.
Telling her to unmute or join?
Yes, please comment on the
Still there?
5G.
Okay.
I'll tell you the truth,
I
that would
may
be
have
our last,
her picture, but then you have other things on the last page, don't you?
no, I was going to, we covered everything except the public health forum. But I did talk about that some, so, I think this is so critical, and she has been wanting to talk about it, so if everybody bears with us just for
Okay.
a couple more minutes trying to reach her.
All right, I sent her a direct message.
Let's see.
Okay, so these other things, the resolutions, letters of
Well,
support.
we're not gonna resolve that, we had the discussion,
Okay.
we'll just have to have another discussion on it.
But you have a few things on here. So letter of support for Heritage Health.
No, those are things that will be they'll be on every agenda, show people what we have worked on. And if there's something else that's critical that comes up, that should be discussed, those are the things we.
Running list of what we're working on, or passing, or trying to
pass, yeah.
Could you please email me a copy of the previous resolution? The final.
Yes.
The final copy that was sent.
The last draft, yes. I did, well, okay, but I'll do it again.
I see what was done, and then we
Well, we'll
also have.
Does anyone have a free telephone? Let's see.
I mean, yeah, I do.
646.
You need a
Although
call?
she may not pick up if she doesn't, I'm in her.
Oh, okay.
Hold on a second, I'm trying. Oh, Dad? Oh, she has this, it sounds like.
Oh, cause it sounded like she picked up the phone.
Yes. Oh, Dad? Very important. So, come back to the, phone.
Join us.
Join us on community board conference, Zoom. Okay. This is Laquita. Oh,
La-
dear.
Laquita, if I may, if you can't get her this evening, I'm gonna check and see if we have time at the executive board. Maybe she can speak there on Thursday.
Okay, I'm sure she would love to, as long as she does, yes, absolutely. So when I do talk to her, get back, that's great,
All right.
Victor. Thank you for bringing it up, because she mentioned, in all fairness, I can't recall if it was our September meeting, I think it was our September meeting, because I remember mentioning that Heather had gone to several. Amir expressed interest in technology, and that's what there's. Yeah, and that, you know, there's so many aspects of health and environment. So
Right,
we need all hands on deck.
absolutely.
You know, no one can know too little, you know, we're learning a lot. And we also, you know, have to be the ears and eyes, as to the extent possible for our community. And just protect our residents, ourselves, our institutions. And that's simple as that. So it would help if, I was so pleased.
I emailed the presentation that was given to the landmark committee meeting to Akil just this evening.
Oh,
So, hopefully, Victor, that went to you, that maybe you were the person who requested it. But I'll
Okay.
make sure this committee also gets a copy of that presentation. That was very enlightening.
Yes, and was Odette at that one, or was
That was
Julie?
there also. I was surprised, but she was there and she spoke, and we already, I applied on behalf of the Landmarks Preservation Committee for consulting status, which means as a board, we can actually go in and make comments.
Right, which she was requesting us to appear at hearings, yes.
And
Okay.
we received the status.
Okay, really? Okay, the representative, the chair are.
Yeah, so,
And we can do that, you know, as long as we're, and as Odette said, we don't have to be so well versed that we know every single thing, because it's too much to learn at one time.
It is,
But everything is going before
But it's moving
Congress,
fast.
and all of a sudden,
right,
and there are a lot of people who will make a decision on us who, because they're maybe so pro-business, which is not necessarily bad, but so pro-business that you don't care about the health impact.
right,
That's what she really stressed. And it
absolutely,
oftentimes happens in communities of color.
exactly.
And we're behind, you know, we're always, just behind what's happening. So far, we've been ahead on it. It's just that it's just so much.
Right. I attended one of the meetings. It was so hard because you have to catch up a lot of resolutions, and also people from all over the United States were on the call. So it's very important, like you said, about our concern to be aware and not be left out.
Exactly. So if we can't we may need to, let's just see what happens. We may need to call a special meeting. But Victor mentioned the executive committee, and I'll ask Odette. Okay, Victor, thank you so much. I think you left. Oh, no, Victor's doing it. Thank you so much, Victor, for bringing that up. And let me just check my notes, here. Announcements. As I get information, I have been forwarding it to the committee. So there's a lot of information, so I try to pick up on certain ones, and then at the same time, send it to the district office, because if I don't see our community board district office number, or a name, like Houston's name there, and I, you know, just forward the information to them as well. There is one thing that's really important. There's a Mixed Tech Up organization. It's the East Harlem Community Partnership. They're offering free transportation to community members to their medical appointments, food pantries, case management meetings, and more. Now, this was emailed. It came from Cheyenne Murillo. And Cheyenne has been really a great point of contact for me at DOH-MH. When we needed, when Victor asked, can you see to it that we get some masks and sanitizers, other items, tests from DOH. I was able to call her that day and the products were picked up the very next day. So Cheyenne has been a real contact. You will see an email from me, but it's coming from her, Cheyenne Murillo. And she said for questions or to schedule a ride, she has the information. And it's not a seniors thing, it's anyone who needs transportation. And so I think this is an important service.
So is this like a assessor ride?
I don't know that part of it, but it's Mixteca, MIXTECA organization. It's in partnership with them. And they're the East Harlem Community Partner. They're part of the East Harlem Community Partnership. So she knows we're Community Board 9, so apparently it's just anyone who needs that information. So of course, you know, for security reasons, they probably have a way, you know, some way of making sure you're protected.
Nice.
But that's important information there. So check that email. And Victor had asked about our event on Family Day. It will, let me just say to the committee, we need you to come out when we are hosting something. And what we were given was, I actually set, how many tables? 6 tables, yeah, something like six tables.
Yeah.
And to set up. It couldn't be done as a health fair, but it was an important day to at least see how we could do a run, you know, what that event would look like. And I think it was really, it worked out pretty well. It rained that morning, so I think that hindered some of the traffic that may have come through there. But thanks to Victor and Yutha's good connection with the Columbia Forum, we got an opportunity to table, and we had a number of organizations that joined us. The Emma Bowen Community Service could not be there in person, but and nor could DOH, but I had their materials at one of our tables, actually at 2 of our tables. One of the West Harlem Development Corporation grantees, Tall Omega Charitable Trust, was there. The Kidney Foundation with our Monique was there. COTA Alliance with our Dr. Yana Runstrom was there. And she had one of her alliances, Reciprocity Foundation, represented by Teresa Mateus there. And I mentioned the bio bus. Really, it was just wonderful to walk through that. So we had a show. We also on my laptop showed our COVID promotions, and that was that we just, you know, kept looping that. So it was really good. People did stop by, take what they could take, and, you know, watched a little bit on the screen. But it's just really wonderful. Please prepare to spend your afternoon with us on February 10th. And of course, Monica, I don't know if she's, I'm off, but she's gonna be working on trying to set up a Narcon training session.
Yeah,
which,
Monica's still on.
I know I had one at the Columbia University Forum, that full day segment. I'm not sure if they did one this year or not, and I got the kit, but I'm gonna tell you, it's really, it's almost scary, you know, you wanna do the right thing. I could definitely sit in that session 2 or 3 times, because you wanna be sure you're doing the right thing if you're helping someone who has overdosed.
Yeah,
So, anyway, she's gonna work to set up, to get the information on training and, she and Victor have recommended or suggested grant houses for, as a location for that training to take place. And so they'll be, Monica will be looking into that. I would love it, also if we could have a second training, because a lot of times we focus on one segment, but there's maybe some need, you know, in another segment as well, uptown. So if we could do two, if, as long as someone's ready to present it, have two
Narcan training.
session,
Is-
Narcan
oh,
training,
okay.
yeah.
Yeah, I mean, it seems like
It's-
that's a need.
Yeah, it's, there are groups that are doing this, so I don't know, if Monica has something else she, or other thinking on that, am I out of?
Is that include? Oh, I don't know. I saw something come up on the screen.
I think you're still on.
Yeah.
You
Oh,
think?
yeah,
no.
yeah, we see you.
No, it's
Yeah.
it's fine. That's all. It's through Oasis. The guy
Oh, I
came
was
to the office.
I was still on.
No, you are, Laquita.
Oh,
And
okay.
Monica, we hear you. Go ahead.
Yeah, it was a guy from Oasis that came to our office. He was very good.
Okay.
And so as soon as possible, Monica, because it's a great idea for us to host, just let us know so we can, you know, begin promoting it.
Yeah.
And it may, that also, and maybe the public health forum might just be, you know, a place to have a set aside area for that as well.
Sure.
But otherwise, I think in a room, devoted to that training would be probably best.
Okay, but
Yeah.
we need dates. You know, he's more than willing to work with us, but we need dates.
What are you thinking about? What is your idea on dates?
I mean, do you wanna wait till January when, you know, everything's over with, where people can just come?
Oh, I will not wait until then. You know, the Christmas season and
Yeah,
it's a
true.
time
That's
of joy and a time of depression for a lot of people. We need to take into account that we may need to be trained to knock on and be able to deliver the service at any time. January is a little bit
So
too
maybe
far.
early December.
Yeah, it's gonna give us a lot of time because we're like already November.
Well,
Yeah,
we really don't have to. He does everything. All we got to do is send out the announcement.
Oh, okay, gotcha.
So let's say, first week in December?
I mean, yeah, I mean, if we're gonna do it, yeah. And she says he's pretty flexible. We should probably get the information out.
These, what day of the week,
We
we're
should-
talking about probably grand houses.
Right, we should see when they make
We
space
got-
available.
We need to work on a Saturday.
But Monica, you're gonna be checking with grand houses, I'm kinda, you get, that's what I was under the impression, you were gonna check, youth has sent the information on the
Okay,
press.
well, I'll reach out to them.
Yeah, we need, if you could take hold of that. And then, of course, we would all just start working on how we would promote inside grand houses. I like the fact that we have a board member who at least lives there.
Right.
And then, you know, can help out.
Certainly help us.
And then, we'll try to find a couple of other people. But the location inside grand houses, I understand, might be a challenge as well. But, you know, I'll, you know, leave it to you to, you know, that's your bailiwick, if, you know, taking on the project. If you talk to the
That's
grand
fine.
house, see what's available.
That's fine. I'll reach out.
Okay.
Monica, if you have any issues, let me know. I can
Okay.
speak to management and the TA president as well.
Okay, I'll do that, Richard.
help secure
I'm
that.
sorry, Victor.
No, you're great. And then, like you said, I think Saturday would be best when we have people home from work, job, school, whatever,
Yeah.
to get as many people in as possible.
Correct.
All right? Okay, great.
Mhm.
And they may, and then they, if they're really involved, they can help, promote
Recruit.
on the inside,
Right.
you know, tenants association.
Exactly.
Oh, okay, so we got that in. And the last, again, just make sure you check, your email, because I know I get a lot of email and it's just so hard, to read everything. But if you see my name or, or the community board, just try to click on, because there's a lot. One of the things, sent out recently, I believe I did it yesterday, because it came, as soon as it came, you can prevent carbon monoxide poisoning.
I
both
saw
in-
that.
In Spanish. Okay,
Hmm.
so, and that's another one I sent to the office.
Okay.
They have several sessions, November 13, November 14, and November 16. So, yeah, 16. So they're coming up really fast. So look at that and get the information out as quickly as you can to whoever, you know.
Okay.
And
Was-
other organizations.
Was it from you or Yutha?
It would come from me. This
All right.
came directly to me from Dylam. And I think Dylam has been here. She's spoken to us.
Okay.
Now sometimes I'll get email and I may not see who else.
Odette is on.
Who?
Odette.
Oh, that's on. Okay, let me just finish this thought. Sometimes I get information just with my name, but I'm assuming other people are on that mailing list. That's just the way it came up. So, but what I send out, you know, it's from me, from somebody else, and it may not be community board.
Okay.
Okay.
Mhm.
Odette.
Hello.
Victor, our chair, brought up, the reminder of, the presentation on 5G towers going up that was presented to our community board. And our chair is gonna present information on this Thursday at executive committee. Number one, would you be available this Thursday to present what's happening legislatively that has a turnaround so quickly, to the community board 9, executive committee? It starts pretty much on time at 6:30, and I think Victor is still.
Yes, I'm still here.
Also, he could give a better idea about what time, you know, he can have you speak, because I know you're speaking everywhere at this point.
Right,
So Odette, this is Victor Edwards, the chair of the board. I sat in on the landmarks meeting that you gave this great presentation about the 5G towers, and I've been speaking about it ever since, trying to rally my landmarks committee, now my health committee, to address this. I know you said that the best way at this point, because of the time constraints, is to focus on our historic district and landmarks so that we can talk about that and the negative impact that it will have on the beauty of the area. If I'm quoting you half correctly, I think that's what I was getting from it.
Yes, Section 106 review is now underway. And what City Bridge is doing is they are making submissions to the State Historic Preservation Office of each of their towers in order to receive public comment and comment from consulting parties regarding the historic preservation impact of the towers in your area. So this is the time that you need to file or request to be a consulting party because the time is closing. They are making submissions on all of the properties right now. And then there's only a 30-day period in which you can comment after the date that they submitted to SHPO. So they're doing this on a rolling basis. And if you're outside that 30-day period, you lose your opportunity. So if you have not applied to be a consulting party, you have to do so as quickly as possible.
I think Heather and Jason applied. Heather, you still on the line?
Yes.
Yes.
And you did apply to be a consulting party, is that correct? Yes, I think that was yes.
Yeah, Victor, sorry. Did you
Okay.
hear that?
Yes, you said yes. And how,
Yes.
And Odette, how do we find out the information about what site that they are, putting up for approval? How do we get that information?
Well, we had a town hall this evening from 4 to 6, and we went over all of that. And so we can, once we have that video ready, we can show it to you. But we do have a reference guide in
Okay.
which, to do that. And so they do have a portal right now where people
Okay.
can go and they can see which properties are up for comment.
Okay.
And so that's also included in that reference guide.
Okay. Now, would you be available Thursday to speak briefly?
Yes.
Our meeting starts at 6:30. We have one other presenter, but I'll try and get you on right after that as soon as possible.
Okay.
Okay, I will have someone send you the link.
Okay.
Laquita, do you have Odette's information so we can email her the link?
Yes. And
Okay.
you probably have it also, Victor, on that, but I'm gonna send it.
I
I'll
also
send
sent
it.
it to Akil this evening.
Oh, and Heather has already sent it to Hakil. He's not in here right now, but we'll. I'm here. Oh, yes, he is.
Right.
Hakil, we're just trying to get Odette, Heather's information that she sent to you about the Tower 5G.
Okay, yes, Heather,
It needs to be sent to Victor, because that has
Yeah.
Odette's.
Okay. All right. But you have her direct information, Laquita?
Yes, I have.
Send
Yes,
it
I
to me,
have.
send it to me separately. Yeah, great.
I'll text you
I
that.
get a lot of stuff, so I get swamped.
Okay, I'll text you her phone number and email.
Email, great, excellent. Thank you in advance, Odette, I appreciate it.
Okay. Thank you.
Odette, another question came up, Heather was asking, what our community board passed a resolution in support of opposing the 5G. What month was that? Was it January or December 22 that we did it? I kind of think it was December 22 and we passed
I believe that was in this year. I think it was in January.
Okay, so that's also, so we've been with this, we're consistent with it. Okay. And I know what's the next thing we need to press forward with environmentally? So we can, I know it's hard, there's so much going on, you had forewarned us. So the landmarks is one issue.
Yes, right now. Yes, right now the landmarks issue is absolutely crucial because once that window closes, you're not going to have another opportunity to oppose it on federal grounds. So you have to do it now. And this is an ideal opportunity. This is a once in a lifetime opportunity to oppose it from a federal angle. So this is a really crucial time. We also have the federal bills, which are trying to undermine what we're doing in New York City and virtually eliminate historic preservation review, virtually eliminate environmental review, and also expressly prohibits moratoria. These are the federal bills right now that are being fast-tracked.
And is there another fast track that we could be working on this committee simultaneously while the landmarks one? Because I know you said things would be moving real fast.
Yes, yes. The important thing is to schedule a meeting with your congressional representative. And ultimately, we also need to meet with Schumer's representative, the staffer, and Gillibrand staffer. But who is your representative or representatives for your area?
Our congressional representative is Adriano Espiat.
And I did invite his office to our landmarks meeting last week.
They have come to our general board, but I don't know if they've been to committees.
But they didn't, I sent it to Shat, Nina and Shana.
Yeah, Nina, that's her name.
But I will follow up with them and also send them the presentation that Rick Meyer did.
Did you hear that?
They did not attend, but I invited them to our landmarks meeting.
Okay, so it's very important to communicate. I've already spoken with Monica Garay in Washington, DC. I was in DC a couple of weeks ago, and I walked into his office, into Espaillat's office, and Monica Garay was very, very wonderful. She's the legislative director, and she did not realize how the federal bills would undermine what we're doing in New York City. So I alerted her to it. I gave her the fact sheets. And what would be great is if there is a meeting of everyone, you know, of constituents to discuss this issue. And I'd be happy to be at the meeting as well to discuss the bills in particular. But this was a very quick meeting that I had with her when I was in DC. So it would be great if we could have a really good sit down meeting to really solidify this issue and to let them know that this is a problem. We're also meeting with Nadler tomorrow and the Nadler staff tomorrow, and we're trying to meet with more and more congressional representatives in the New York delegation in order to stop these bills from passing the House.
You mentioned Senator Schumer. He has spoken at community board before. I think it was maybe 2022, early 2022.
Before he became speaker, I want to say.
No, before he was leader. I think he was leader. But anyway, yes, he was. That's right. He was leader then. So through our office, we should be able to find some New York City connection, you know, with this legislative process. And
yeah, that would be great.
Have you seen an instance where they've all met together, like the congressional representative's office and the senatorial office have, you know, like in a joint meeting?
Well, we haven't had joint meetings, and I think it's best to have separate meetings because they represent different constituents. But with respect to Schumer and Gillibrand, I think, you know, a lot of us can be at the meeting with either one of them, because ultimately, if these bills pass the House, and there's a very good probability that these really bad bills are going to pass the House because they've been attached to a must-pass bill. And that's the NTIA Reauthorization Act. So the NTIA Reauthorization Act, that's the National Telecommunications Information Administration. They're the ones who are putting out the BEAD money from the Biden administration for the new Infrastructure Act. So, and they're placing an emphasis on fiber. These bills are placing an emphasis on wireless, that they can put them anywhere they want and you will have no say at all. And it makes it look like you have a say, but they have such a stringent time clock for localities to review this, and they can be pummeled with so many applications. And if they don't have a good reason for denying it, it's going to be deemed approved. And it's just as one of the attorneys said, who works in this area, he said this is the most evil. This is the most evil bill he's ever seen in his entire 30 years of practice.
He said evil.
And he said it was the most evil bill he's ever seen in his 30 years of practice. So
Wow.
yeah, so we do need to talk to Espaillat. His staff is very receptive. So will someone be able to, you know, put something together, and then I'll, you know, let me know and I'll be happy to attend.
Do you mind, Victor, if I
He got off, yeah.
Yeah, he did leave off. I'm gonna when I send him Odette's information, I have we all have contacted his office now, just mention that. And maybe Heather, we could be on the phone together because you have the landmarks issue that I'll be talking about the legislative part.
Okay.
Well, let's work out tonight. If we could do it during the day.
I'll send you the presentation.
Yeah, because I want to be as,
Yeah.
you know, tight on that as possible. They had predicted this, and that this is where we are. We need Amir, I really hope you can take an interest in this part and help guide us. We got just the pros and cons of just looking at it, you know, and and Heather, I was so pleased when we happened to be on the phone. I knew I was attending the meeting, but this is several months ago now. And Heather was on, I was so delighted. And then I had missed the part on the landmarks, but Heather was there, and Odette knew to reach out or have her people do that. And if we need to have a conversation with one or two other people before, I think, you know, like, get a committee, get a Zoom together, you know, the next few days, even after the executive committee. Then I'll let everybody know to see to be on. So that we can be in front of this issue. And it's hard to be in front of it now because of how things
have been moving.
All right, so this worked out, all the new business came in together, and, Kamir.
I guess.
Pete, am I on the agenda? Because I've been waiting 2.5 hours to present. And I've messaged repeatedly.
Oh my
No,
God.
I've messaged repeatedly. I've spent my whole evening here.
Yeah.
Well, you wanna say something, Isaac? Go ahead. Isaac Adlerstein is with Broadway Community. He's a West Harlem Development Corporation grant, and I think I know why, Isaac, you responded. You probably got the first email where it was where the November 2022 agenda was attached and your name was there. That's what it was. And then
No, I'm supposed to present because we had emailed back and forth because we're a grantee from West Harlem Development this cycle as well.
Okay, go right ahead.
Okay, I'll keep it brief. But Broadway Community is a human service agency located on 114th and Broadway. We've been around for over 40 years. We have a soup kitchen, a food pantry, on-site medical services, a shelter, which serves as the model for the mayor's recently announced program to launch 50 shelters within houses of worship over the next 2 years. We have a computer lab where folks can get assistance applying for jobs. And we have a life skills program. And it's been, quite an exciting period for us. We unfortunately have seen a 156% increase in the number of meals that we've had to serve from January to October compared to January or October in 2019. So the year before the pandemic. We're seeing over 250 families each month come to our food pantry. And the need for shelter is just becoming far, far worse. We were very pleased to serve as the model for the program that I mentioned, where the city will be launching 50 shelters within houses of worship. We actually served as the principal consultant for the first 3 months of the contract. But unfortunately, it has not moved as quickly as we would like. Only 2 shelters have opened thus far, and the city had set a goal for 40 to open. We're doing some exciting things in the community board. We're talking with Mount Pleasant Baptist Church on 120th and Adam Clayton Powell to create a mobile food pantry to deliver fresh groceries to one of the local SROs. We're talking with some folks from the NYU Dental School to try to bring adequate dental care to our neighbors who are experiencing homelessness and hunger. We've had some very exciting conversations with the Bridge, which is another homeless service provider on 108th, and we're exploring ways to partner there. And then we're in continued conversation with Cathedral Community Cares at St. John the Divine and Riverside Church, talking about how the 3 of us could work together to provide a broader range of services for our guests. With all that said, we're going to be hiring a full-time director of spiritual and social support come December 1st. One of the things that we hope will come along with that is doing outreach within the community board. So we're hoping to canvass areas regularly from 96th Street to 125th Street between Riverside and Adam Clayton Powell Boulevard. and just engage the folks that are living on the street and build relationships with them, and then hopefully bring them into a place like Broadway or other supportive organizations in the area. So yeah, that's what we are up to.
Continuing to do big and better things. You're a terrific organization, and you're not looking for a letter of support right now. You're just
At the moment, yeah, just
right.
want to update the community board as part of our agreement with West Harlem Development Corporation. Just keep y'all updated on what we're doing.
This is very much
Very good.
appreciated. I'm sure you did, as I'm thinking about it, there were some notes I made, and you had, let me just, deepen my apologies. No, yep, you're right here. You had mentioned that you wanted to come to this meeting, so it was just an oversight on my part. As you can see, you're always welcome.
Thank you.
And you could have pulled my coat a little earlier, actually. You're very polite.
Next time I will.
But I'm glad you were here to hear everything that's going on. And we need your support as well, to be the eyes and ears for the community on other matters as well, where you can give us some insight as someone who provides services, particularly to the homeless. When we were talking about different services in the areas of health, residential parking, there are a number of issues where we could use your suggestions. Just give us a little note.
Could I ask Isaac a question? I think the work that you do is so important, and something that I actually, I know we probably want to call the meeting to adjourn soon, but something I wanted to bring up related to the Narcan training that this committee will be working on. And I think it would be really great if we at a future meeting could have a more robust conversation about overdose prevention centers. I know they're really under attack. That I think I've heard that the mayor has threatened to withdraw funding for overdose prevention centers. There's only 2 in New York City. There's one in Washington Heights and one in East Harlem. They're sometimes called supervised injection sites, and they've been proven to reverse hundreds of overdoses, to save hundreds of lives. And this kind of harm reduction approach to injection drug use, I think, is so important when people are navigating lives of stigma and criminalization, state violence, anti-homeless violence on the streets. So I mean, if Isaac, does Broadway community have a perspective on overdose prevention centers, or a position on them? And if we as a community board were to come out more aggressively in support of them, maybe adopt a resolution that I'd be happy to take a lead on. Is that something that would align with your work, do you think?
Absolutely. I mean, it's just horrific that over 120,000 Americans passed away from overdose in 2022. And, we have to do a better job of overdose prevention work. And that includes Narcan training, that includes safe injection sites, and just building more robust supportive services. So, we're in favor of all things that will lead to a reduction in overdose deaths and people recovering from the struggles of addiction.
Great. Well, I think that I really appreciate that feedback. I'm worried that sometimes in places and vehicles like community boards, a NIMBY attitude of like, oh, that's great, but I don't want it over here.
That is what has happened.
And I as a new community board member and as a member of this committee, I'd like to really gently push back to that perspective and say, yes, in my backyard, yes, here, we obviously really do need it. And So maybe as
Well,
we can
the
add to the
big-
agenda, we can maybe discuss this at a future
So
meeting.
that's our area, is something, health is definitely health related.
Yeah,
And so we have
And it's a
to
need.
find a way to deal with it, there's a need, but, we are also, the big issue here is that we're also oversaturated, so we gotta find a way.
the balance.
We gotta find just a way to even tackle that,
Yeah.
because there is such a thing as, like, bring it here, and there are numbers that, indicate that we are probably, from what I saw, more saturated with that kind of, I'll say, specialty than in other communities, but that doesn't mean we can't try to tackle that in some way.
Well, the
You know.
most important principle for harm reduction is you meet people where they are. And that means here in our community. And I think fighting for the human dignity and fundamental rights of people who use drugs and other people who are hyper policed and face so much violence matters to me personally as a member to this committee. And I'd like to maybe talk about this at a future meeting if we can.
Absolutely.
Yeah.
Absolutely. Yeah, we can't
I mean, the
not
need,
talk about
right, the
it.
need is here.
Yeah.
There
Thank you,
was-
Isaac, for your presentation. Yeah.
Absolutely. Thank you.
And your patience.
Absolutely. Thank you.
Need you. So you got an assignment.
There was someone else representing an office. I guess she hung up.
Mary.
So,
Right, from O'Donnell's office, right?
Next time you come back, just be in touch, okay?
Will do.
Yana, Dr. Randstrom, there was something in closing you wanted to mention in reference to COTA and the LGBTQ community. I just saw that.
Yes, thank you. That was just, I put a quick note in the chat as well. Just to, if you have a possibility to reach out to any organizations in the community that have LGBTQ clients that work either solely with them or even partially with them. We're doing another COTA Health Equity Forum on November 16th at COTA Nest at 43 St. Nicholas Place, just to kind of present to each other what we're doing, see where there are potential gaps in services or new needs that need to be addressed and such. And it's kind of casual. We do have a keynote speaker from one of the organizations, and then we serve everybody lunch and coffee. So there's an Eventbrite link where people can register. So
Do you
thank
have
you very much.
information that you can send? I see your website here, but that's just for a registration. Do you have a flyer? Because we also have an LGBTQ committee.
Mm-hmm.
And I reached out to
I'm on that
their
task force.
co-chair
Oh, yeah.
to do a
You are?
presentation on, what are the health issues that we could support in particular. But at that time, I guess he was swamped and didn't get back. But I think it would be great if you could get that information to
John Martin.
you.
Yes, one thing I did send it.
For Thursday, when the executive committee meets, so that even just to Youth of Prince, you see Hakil Ellison's name and Madison Ayala, or even to me, then I can forward it. And
Yeah,
then
I sent it like a day or two ago by email to you, and then I wanted to send it to the LGBTQ subcommittee, but unfortunately I didn't notice we missed their meeting because they meet at the end of the month, so we missed their October meeting. But I put a note in the on the website there's a form, so I filled that out, but I have a suspicion that maybe those forms don't get looked at, and I can't find email addresses for the members of the various subcommittees on the website. So I don't know if you could do that systematically, or maybe you could send me the information separately.
Email me or send me email me tonight and I'll email right back to you.
Great,
okay?
Thank you so much.
Contact information, because it's two, not only John Martin Green, I think I can't remember the other.
I think the
offhand.
task force is just 3 of us, and John Martin, I think, is the only chair, and,
Right.
and there's only
Oh,
2.
you're Amir.
Yes, yeah.
Oh, you're on there. Okay, good.
Yeah.
Very
So
small.
this is great. Okay, so Amir, can you take this on? And-
Yeah, yes, I mean, I'd be happy to type John Martin's email in the chat, but I'm not on
Or do a
Zoom.
copy, or take a picture of this, of do a screenshot
I
of
mean,
that
You
chat.
could do that, or you could type it in. over
Yeah,
here.
or here's John Martin.
Yeah, cause it's gonna close, when we close, oh my goodness, I
Right.
have Victor, oh Lord. Let's see,
I can, try to type it in.
oh,
It's just.
are you really
Hold
calling
on.
me?
Are you want me to send it directly to her? Yeah, I guess so.
Yeah, sure.
Wait, hold on.
Oh,
I don't see her
wow.
name.
Okay.
Oh, here it is. Okay, go ahead, John.
So it's John Martin Green
Oh,
with
well,
an H, yeah, all John, yeah, John Martin Green at gmail.com.
wait,
Yeah, we were
does he have
almost
no
there.
E in the end, right?
Uh,
No E in the end, right?
No,
What, Gmail?
at Gmail, yeah.
Oh, that's it?
Yeah, that's it.
Okay, that's pretty simple. I should know it. Okay, just make sure.
I'll send
John
out,
Martin Green at gmail.com, right?
that's it for me.
Right?
Yes, yeah,
Okay,
John Martin Green.
okay. I hope I will, okay, that's pretty straightforward. Right.
You might not,
Danya, I just sent it to you directly.
Thank you.
The authority.
Let us know if it goes through, it should.
yeah, we might not be having a meeting in November because we're actually trying to organize a film screening, like a queer themed film screening that might be held at the time of our LGBT task force meeting, but we can definitely be in touch and hopefully try to coordinate something.
Yeah.
Okay.
Get that information to him so
Yeah,
that, you know,
yeah.
he can share it. You can share it.
So now we have to close out because Hakil was supposed to have been able to leave at 9:00. But I
Okay.
think we have covered everything.
Motion to adjourn.
And so
Yes.
let's be a little orderly though still. Quickly get a motion to, let me just ask, is there any other business? No, I don't think so.
No.
Have a motion.
So moved.
Second.
Second,
Yes.
so, moved by Amir, by Monique and Elizabeth, okay?
Right.
So, we will end the session. Thanks, everybody. for
Bye,
being
everyone.
on with us.
Hi,
Traveling
everybody.
Mercies cocktail.
Yes,
Okay.
coming back Wednesday, waiting forwards.
Give me a
Bye.
call.
Yes, I do. Monique too.
Bye,
Nice,
Miss.
seeing
Get
you
some
in
rest.
person, yeah.
Yeah.
Bye.